how does sensitive toothpaste work? Well, basically, they desensitize your teeth because they have desensitizing ingredients inside of the toothpaste. So there are two general or broad categories of these desensitizers, and how each of them works are via two different mechanisms. The first class of desensitizers are what I call the nerve depolarizers, and then the second one would be the tubular occlusion agents. Okay, so we'll go over each of these two and kind of like the mechanism and how they block the sensitivity for you. But the first thing we should discuss is how your teeth get sensitive in the first place. Okay, so normally, you have like a thick enamel layer that does not have any nerve endings in there. But if for whatever reason you're missing enamel, or the enamel is thinning out, or you have gum recession, or you have exposed root, right? Like the nerve endings that come out through like the tubules in the teeth, which are basically like pores, right? Like you drink cold stuff, and whatever you eat will kind of go straight in, and then it stimulates the nerve, and then that's how you get like that sensitivity or pain signal. Okay, so it's actually really interesting because according to Dr. Brandstorm, it's like he has the theory of dental hypersensitivity, or the hydrodynamic theory. His theory is that if you drink certain substances like cold or hot, right, it'll actually kind of move the fluids within the dentinal tubules, and then the nerve senses the movement in the fluids, and then that's how it sends a sensitivity signal. So here you have, like, if you're drinking hot stuff, the fluids actually move towards the nerve, but then if you're drinking like cold things, it actually kind of pulls it away from the nerve, and then like those movements cause you to feel sensitivity. All right. So the first desensitizing type of agent I want to talk about would be the nerve depolarizers, which would be potassium nitrate. It is actually the only nerve depolarizer. So the Sensodyne Pronamel is the classic example of potassium nitrate, 5%. So how potassium nitrate desensitizes your teeth is by depolarizing the nerve. It actually, you would have to remember how action potentials are generated from nerve cells, but basically what the potassium nitrate does is that it floods the nerve cell with an overabundance of potassium ions. Okay, so how like the how the action potential is generated is that the first thing that happens is that the gates open, and then the sodium ions flood into the cell, and then the second part is that the potassium ions will kind of come out of the cell. Okay, and an important concept to understand is that these ions, they move towards a high concentration towards the low concentration. So, in the beginning, there is a high concentration of the sodium outside and a low concentration sodium on inside. So that's why the sodium comes into the cell. And the reverse is true for the potassium, right? At the beginning stages, there are a lot of potassium ions inside the cell, but very little outside the cell. So what the potassium nitrate does is that when you brush with it, there's like an overabundance of potassium on the outside. So the potassium cannot flow outside, right? Because there's too much outside. So because of that imbalance, it prevents the nerve from firing a signal. So basically, like, the best way for me to describe how potassium nitrate works is that it works very similar to like a numbing agent, right? Kind of like Novocaine that you get at the dentist. Like the tooth nerve is numb, and your dentist is drilling on you, but you don't really feel any pain, and it doesn't really bother you. Okay, so that's basically how the nerve depolarizers work. The second type of desensitizing agent would be the tubular occlusion agents. Okay, so how these work is that, if you remember from the very first picture, right, you have like these exposed pores and stuff kind of go straight in and interact with the nerve. So what the tubular occlusion agents do is that they literally block the pores. So here we have one that's called arginine. So this is a tubular occluding agent where, before you have like these open pores, but after you brush with it, you see how it's like all filled in. The same could be for like the hydroxyapatite as well. You have all these exposed tubules, right? And then you have like the hydroxyapatite come in and just plug up all of those tubules. So the common tubular occlusion agents would be hydroxyapatite, stannous fluoride, arginine, and then there are a couple other ones too, but they're not really that widely available in the US. In the US, it's mostly just stannous fluoride and hydroxyapatite, to be honest. So for Sensodyne, we'll have the stannous fluoride here. Right, stannous fluoride. If you look on the purpose, it says anti-hypersensitivity. And then we also have the hydroxyapatite toothpastes, such as like Risewell, right? They call it a mineral toothpaste. But if you look in the ingredients here, you have the hydroxyapatite. So these two work in the same way. They kind of block up the open pores in the tooth, and then it prevents the cold fluids, the hot stuff you're drinking from going into the tubules, and that's how it blocks the nerve. Okay, and then the third and last thing I want to talk about is, which sensitive toothpaste works best for you. Honestly, you won't really know. Some people respond better to the nerve depolarizers, and other people respond better to the tubular occlusion agents. Okay, but basically, if you've been brushing it for like 2 weeks up to a month and it's not working for you, you should try switching to the other agent. It may be more effective for you. All right. So that is like one of the big causes for when sensitive toothpaste does not work for you. Or alternatively, you could try a toothpaste like this one here. It's called the Ollie toothpaste. This one actually has both desensitizers in there. It has the potassium nitrate right there, but it also has the hydroxyapatite in here, right there, hydroxyapatite. So if you're unsure about which one to use, you could just get one that has both of them and just brush with it. That way you have all of your bases covered. Okay, so that's basically how sensitive toothpaste works, right? So just to recap, they work because they have desensitizers in there, and these desensitizers can work either one of two ways. The first one is by depolarizing the nerve, which is similar to numbing the tooth nerve, and the second way is by tubular occlusion, which is essentially blocking all the pores and all of the holes, so none of the stimulus can go inside and interact with the nerve. Okay, and that's it for this video.